Recently, India's total fertility rate has dropped to 2 as per latest National Family Health Survey figures released by Ministry of Health and Family Welfare. Now this is a very significant achievement as far as India's population demographics are concerned. Now due to this reason, it becomes a very important topic from this year's prelims examination perspective. Now first we have to understand what do we mean by total fertility rate. See, there is a concept of replacement level of population, and United Nations Population Fund, that is UNPF, define replacement level of population as 2.1. See, it is 2.1 in the sense that if two individuals, that is husband and wife, procreate two children, then essentially one generation, that is father and mother, is going to replace by next generation, that is their two children or offsprings. Now this will stabilize the population. But why is it 2.1 and not 2? See, this additional 0.1 is because not all children will be able to survive due to infant and child mortalities or morbidities. Now as per latest figures, India's TFR has dropped to 2, which is below the replacement level of 2.1. Now how is TFR defined? See, we first must understand that generally a woman's reproductive age begins around 15 years of age with onset of her menstrual cycle, and it generally ends around 49 years of age with the onset of menopause. See, TFR is the average number of children procreated by a woman or born to a woman during her reproductive age, that is from the age of 15 to 49 years, that is during this lifespan, total number of children born. So if you sum up the total number of children born to all women during their reproductive age and divided by total number of women who gave birth during this reproductive age, you will arrive at a statistical figure of TFR. Now in case of India, TFR stands at 2. Now see, we are studying about demographics. Let us also take a look at other conceptual terms that could be asked in the examination. Let us take a look at demographic transition theory. See, this question related to demographic transition theory has already been asked in the exam and could be repeated this time also. This theory argues that population dynamics of a country transits through 4 stages, and this demographic transition is primarily shaped by the socio-economic conditions and level of economic development of that particular country. The first stage is high birth and high death rate stage, and this will happen when the country is economically underdeveloped or it is relatively poor. The death rate is higher because less developed countries have poor healthcare facilities and poor standards of living and poor sanitation facilities, and therefore life expectancy is lower in these countries. The birth rate is also high because here agriculture is the prime occupation of the people, right? So you need more hands, more number of people to contribute to agriculture labor. Also, people will procreate more so as to compensate for the higher death rate among the children. Also, birth rate is high because contraceptive practices like birth control, use of condoms, and sterilization policies and sterilization practices are almost negligible during this stage. Now this stage corresponds to low population stage, as both birth rate and death rate are high during this stage. The second stage is high birth rate and low death rate stage. Here birth rates will remain almost same because see, it is difficult to change people's thinking, people's ideology and people mindset. So people's mindset related to procreation and manhood won't change during this period. Whereas death rate will continuously decline during this stage because of the level of economic prosperity, economic advancement, government interventions. Government will be launching various kind of schemes. Government will be augmenting its healthcare facilities, right? For example, India's Janani Shishu Suraksha Yojana was formulated to bring down infant mortality rate and maternal mortality rates, and therefore life expectancy improved. This stage corresponds to the stage of high population growth or population explosion because death rate has significantly reduced, whereas birth rate will remain the same as compared to the previous stage. The third stage is low birth rate and low death rate stage. See, here birth rate essentially decreases due to a variety of factors. For instance, socio-economic advancement of people and transition from agriculture to manufacturing and services sector. Growing aspirations of parents for their children and their high spending on their education necessitates procreation of lesser number of children due to this high spending towards children's skills and education. This is especially related to expansion and proliferation of middle class and its aspirations. Also, urbanization is rising in India. During this stage, marriageable age of women will also increase. Women empowerment and education will take place. So women will have more autonomy and choice as far as their bodily decisions and family planning is concerned. In this stage, increased uses of contraceptives like birth control pills, sterilization, increasing use of condoms will lead to low birth rates. Now this stage corresponds to the stage of population stabilization. Here momentum in the growth of population as witnessed during the previous stage is reduced and population stabilizes. India currently has entered into the third stage of demographic transition. In fourth stage, the birth rate further declines and death rate remains almost the same compared to the previous stage. Now countries like Japan and highly advanced countries are in this stage. Here, due to low death rate and higher life expectancy, the number of old age people are going to increase, and process of aging or the phenomenon of aging is witnessed in these economies. Here the population is in the declining phase. Here population will start declining and start contracting. Now let us study about two important concepts of demographic dividend and dependency ratio. Now overwhelmingly during second stage and to some extent during third stage of demographic transition, there is a window of opportunity for countries to leverage the labor potential of growing and expanding young population for the growth and economic prosperity of the country. Now this is called as the demographic dividend of that country. See, this is a very brief window as youth population ratio to the total population structure of the country would be more, and therefore youth should be extended proper skills, human resources should be properly nurtured, and they should be extended the knowledge to tap into the market opportunities or jobs. And it could be a huge asset for our country. Consider, for instance, the increasing number of startups and in contemporary India. It shows the entrepreneurial ability of the youth of the country. Now, why is it called a window? Why is it a time window? Because this window will be available to India at max during the decade of 2040s to 2050s. So we have 30 to 40 years to utilize this demographic dividend window. And after that, our population structure is going to change as the youth population proportion will decrease over time due to the demographic transition. Now, proper definition of demographic dividend is the total working population or total productive labor force belonging to the age group of 15 to 64 years, right? So this age, working age is start from 15 years and at 64 years. So this range is prescribed by UN Population Fund. And this question has already been asked in the previous year's prelims examination, and it could be asked again. There is a probability that they will be asking it again. Now let us try to understand what is dependency ratio. See, it is the ratio of total proportion of population which is non-productive and are dependent on others, right? So who are dependent on others? See, senior citizens who are more than 64 years of age or children less than 15 years of age, right? Those who are not falling in the productive working age will be dependent on the working population for their survival, for their maintenance, right? So now these people who are participating in the labor force will be supporting the dependents belonging to the non-working age. Dependency ratio will be generally higher in later phases of demographic transition, as is being witnessed currently in the advanced economies of Japan and OECD countries and Scandinavian countries. Now let us take a brief look at the findings of the National Family Health Survey. See, we need not cram the statistics, we only need to focus on the general trends. See, the first trend that is witnessed or that you could conclude from this report is the TFR, it varies across states, right? It depends on their levels of development societal practices and cultural practices of that stage. It could be deduced that it is going to be highest in Bihar. In Bihar, it is almost touching 3, right? After that, a surprise comes. Meghalaya comes at the second position where it is 2.9. Then this is being followed by the states of Uttar Pradesh and Jharkhand. And it is low in the states of, it is lowest in the states of West Bengal and Maharashtra where it is 1.6. Secondly, the use of modern contraceptive methods to prevent unwanted or unwarranted pregnancies has increased from roughly 48% to 56.5% as per latest National Family Health Survey figures, right? Thirdly, sterilization or permanent contraception burden mainly lies on women, as it is being witnessed that female sterilization or tubectomy is roughly 38%, whereas male sterilization or vasectomy is abysmally low at 0.6% only. This is due to issue of patriarchal taboos, as male should not give up his power of being a procreator, and being a procreator is being seen as a sign of manhood, right? That is why it is abysmally low among the male population. Fourthly, NFHS also points out that the institutional deliveries in healthcare facilities rather than from a traditional buy has increased to 89%, and this has led to decline in infant mortality rate and maternal mortality rate due to safe delivery under professional supervision. One important point we must keep in mind that India's population will still grow even if it has reached the third stage of demographic transition. Various estimates suggest that it is going to peak, right? It will attain its maximum by 2050, and after 2050, it will enter into the fourth stage of demographic transition. That is, its population will contract, its population will decline, right, after 2050. So these figures and NFHS findings clearly points out that there is no need of coercive family planning policies like forced sterilization or two-child policy. An important fact that you should remember that as per various estimates, India is going to overtake China as the world's largest populous country in the current decade at max by 2027 or 2028.